Okay, so talking today about substance abuse and dependence, and particularly applying this to problems with alcohol. Okay, so differentiating substance dependence from substance abuse. The current DSM distinguishes between these two patterns of use of substances. In the upcoming DSM, there is only going to be a substance use disorder, so they aren't going to differentiate between dependence and abuse. But for right now, learning the distinction is important. So substance dependence, this is the more severe of dependence and abuse, okay? So dependence, you're dependent on the substance. You habitually use it, so that means you repeatedly use it. You have preoccupation with the drug, so you are trying to find this drug whenever possible. It produces harm to you or to someone else. And then you have the psychological or physical dependence on the substance. Additionally, oftentimes individuals who are dependent on a substance will use more of a substance than they had intended to use. They also show this persistent desire to control the drug use, but again, they have that unintentional overuse as well. So the efforts to control are not successful. Individuals who have substance dependence also show two characteristics, tolerance and withdrawal. So tolerance, you basically build up an immunity to the substance. So it takes more and more and more of the substance to achieve the high or the euphoria that came when you first started using. Withdrawal also, when you stop using the substance, you experience severe symptoms. So for individuals who stop using heroin, for example, they might experience extreme dizziness, nausea, vomiting, really unpleasant side effects. Individuals who stop using alcohol, if they have a consistent pattern of alcohol dependence, can actually die from withdrawal symptoms from alcohol dependence. So pretty serious stuff here. And then in addition to all of these other criterion here, individuals who are dependent on a substance often abandon important responsibilities, whether these are to other people, to their job, recreation, because they are using the substance, and they continue to use the substance even though they are having problems in multiple areas. So substance dependence then is more severe than substance abuse. So with substance abuse, this is a drug pattern that has not progressed to dependence. Individuals in this category have recurrent drug-related failure to fulfill major role obligations. So they might not show up for work regularly because they're hungover from the night before. They use these drugs in physically dangerous situations. So let's say that you get really drunk and then you decide to go drive your car around. So that is definitely a physically dangerous situation. Perhaps you have gotten a DUI because of your substance abuse. So that's a legal problem as well. And then continuing to use despite these social or interpersonal problems. But again, not as severe as substance dependence. Anytime you're working with individuals who have problems with substances, it's really difficult to be able to assess accurately what's really going on. What is this person's typical pattern? Oftentimes, individuals will deny how serious the problem is. They might outright lie about, the severity of the problem. So you then, in doing the assessment, will want to make sure that you validate the individual report by talking to other people who are important in this person's life. So you're going to want to talk to family members to get maybe a more accurate picture of what's going on. Another way to assess usage, if they're already in some kind of treatment program, is to use urine drug screenings, where you sample urine lab tests to see what kinds of substances this person has been using. Okay, so let's focus on alcohol then. So alcohol, the most widely abused substance in the United States. And it is, in terms of the immediate effects, it's really difficult to really estimate the effects of alcohol to society. So Use of alcohol results in decreased work productivity that costs the United States about $70 billion a year. Treatment and support services for alcoholics cost about $20 billion. Alcohol-related automobile accidents, $13.8 billion. So clearly, significant cost to society. So the immediate effects of alcohol. Alcohol is a stimulant at small doses, but in larger doses it is a depressant. So that means it slows down activity in your central nervous system. Central nervous system is composed of the brain and spinal cord. The initial effects of alcohol, again, can be to stimulate rather than depress, producing changes in mood and social behavior. So you might initially become happier. You might find yourself talking to people more than you would normally. But over time, again, with the depressant effect here, you might feel really sleepy. You might feel really aggressive. And then also changes in judgment as well. So you might make decisions that you would not normally do because alcohol reduces your inhibitions. In terms of long-term effects of alcohol, we can talk about several long-term effects here, but it's basically a progressive disease that can eventually lead to death. So let's look at one model here of how individuals might start developing dependence on alcohol. So this is Jellinek's 4-stage model of alcohol. And according to this model, which I believe Jellinek proposed in the 1950s, so it's been around for a long time, but he proposed that alcoholism is a predictable and progressive disease. Individuals vary considerably, but they show apprehension, agitation, dysphoria, guilt, remorse, despair, hopelessness, futility, self-deprecation, and insomnia. And so according to Jellinek's model then, alcohol dependence develops quite slowly. So first you have your pre-alcoholic phase where the individual is a social drinker. Then some individuals might progress into the prodromal phase where they start having blackouts. They become preoccupied with procuring the substance, and then they start developing some kind of guilt over their use of alcohol. Moving later, for some individuals, into the crucial phase where they start sneaking drinks, they start losing control, they become very, very preoccupied, and they withdraw from their obligations and from other individuals. And then finally, in the chronic phase, loss of tolerance, there's obsessive drinking, some tremors, the delirium tremens or the DTs, that is a side effect of repeated alcohol abuse. Something else that happens in this chronic phase that is indicative of severe alcohol dependence, individuals who drink in the morning. So morning drinking, indicative of alcohol dependence. Okay, so let's talk about some of the groups who are at risk here for alcohol abuse and dependence. So in terms of gender, males are more likely to develop this than females are. Looking at ethnic groups, so Native Americans actually have a very high rate per capita of alcohol abuse and dependence. They're especially at risk, and this might be related to cultural norms, destruction of their way of life, and poverty as well. If we look at religion also, we find that conservative Protestants are very resistant to alcohol problems, but Catholics have a high percentage of alcohol use and abuse. And looking at age, adults drink less, young people tend to drink more. About half of college students binge drink, so this is consuming a large amount of drinks in a small period of time, sometimes defined as consuming 4 drinks for women in 2 hours, 5 drinks for men in 2 hours. So college students, appear to be especially at risk for this, especially college students who are members of Greek life, fraternities or sororities. They seem to be at even higher risk for alcohol abuse. Okay, so let's say that you suspect that someone that you are working with, a client, has a problem with alcohol, and you want to figure out pretty quickly how is the problem progressing, or what's going on with this person's problem, how severe is it. This CAGE questionnaire, just a 4-item questionnaire, you could ask a client, and it assesses 4 different areas of alcohol abuse. So first, asking the individual if they've ever felt they should cut down on their drinking. Have other people annoyed you by criticizing your drinking? Have you ever felt guilty about your drinking? Have you ever taken a drink in the morning to steady your nerves or get rid of a hangover? The eye opener. So this questionnaire then, if the individual has 2 or more affirmative, so if they answer yes to 2 or more of these questions, it indicates that they likely have alcohol dependence. So this is a quick way to kind of gauge that.